We just told you a few minutes ago, Nebraska hospitals are seeing more COVID-19 patients than ever before. But what happens to patients who aren't critical enough to stay there, but are still too sick to go home?
Well, an Omaha family tells us that their loved one had no place to go. As KETV Newswatch 7's Michelle Bandur investigates, there are options in Nebraska, including one offered by the state just for these pandemic patients.
Both Don and Shannon Meyer have COVID-19. They're 85 years old. Shannon's more severe symptoms put her in Lakeside Hospital.
She started exhibiting, severe weakness, short of breath, and some severe back and neck pains.
Their son, Don Jr., is also positive, exposed by his parents during trips to the emergency room. The first one, October 27th. Doctors, though, sent Shannon back home to Maple Ridge Retirement Community. However, the next day, Don took his mother back to the doctor.
Once they saw the condition that she was in, they sent us right back to the emergency room at Lakeside again.
But less than 1 week into her hospital treatment, Don received a frantic call from his dad.
Due to the shortage of beds, they wanted her to transition out. And since they were unable to get any rehab facility to take her, they were going to send her home.
To recover at home, Shannon, who is wheelchair bound, needs private in-home care. But the Meyers couldn't find anything affordable since she also has the coronavirus.
Pretty hefty chunk of money out of your private pocket.
They were stuck.
And when you're looking at there's no place for your loved one to go, it is pretty frustrating. It's a big emotional roller coaster.
Shannon Meyer is one of the unknown number of COVID-19 positive patients who fall somewhere in between, not sick enough to receive that critical level of care at the hospital, but still too sick to recover at home.
There's got to be another way. There's got to be someplace else, what is available?
Finding few options, the Meyers did locate a safe place for Shannon, nearly 2 hours away in Corning, Iowa. CHI Health Mercy had a room through what's called swing bed critical access care.
Small hospitals outlying the metro area that would take the patients and care for them until they are COVID-free.
As the KETV Newswatch 7 Investigates team looked for help, we discovered a state program called the Nebraska Accommodation Project.
It's not just DHHS, it's not just their government, it's a hotel. It's a maid. All of these people have come together to provide care.
Using CARES Act funds, the state contracts with hotels to provide temporary housing for people in similar situations as Shannon Meyer.
We have RNs and CNAs that do the rounds. They take their temperature, they check pulse ox.
Hotels designated for isolation may provide on-site health care or telehealth for positive patients who've been exposed but can't go home because of a high-risk family member.
That sense of community support and that sense of Nebraska strong and that Nebraska spirit where we all stepped up, sometimes just that makes a huge difference in a person's life.
An option Meyer wished he'd known about for his mother. He believes other families just give up and go home.
There's a lot of people that are probably getting checked out that probably shouldn't be going home that are.
We've learned 400 people have already used the Nebraska Accommodation Project. If you'd like more information on the project, you'll find a link in my story at KETV.com. For KETV Newswatch 7 Investigates, I'm Michelle Bandur.
And the state says that the programs also help hotels as well, since the tourism industry is struggling. More than 60 hotels across Nebraska are taking part right now.
Yeah, people in quarantine are not allowed to use hotel amenities like the gym, but each room does have a kitchenette and their groceries are delivered so they can make their own meals.